Hi. So I want to make a video about how I got approval for my bariatric surgery. Now, everybody's journey might be a little different. Um, every doctor might have different requirements for getting the surgery. Also, depending on if you're going trying to go through your insurance, you might have several other requirements for that too. But this is how I did it, and this is how a lot of people that I had to talk to about getting the surgery went through. So first was finding the doctor that I was comfortable with working, which was fairly easy because um, a lot of the people that I talked to recommended their surgeon, and I was more than happy to go with him because um, a lot of other people had a very good record with him, and they had a pretty good history with him. So I was more than happy to do that. So once I found the doctor, I got to contact him for a new patient appointment. I got to see him for my new patient appointment, where he gave me a basically like a basic physical that he needed. And also, he gave me a list of doctors that I had to see in order to get all the approvals for the surgery. Um, and I actually had, I actually had to see about 6 or 7 different doctors before I got all the approvals that I needed. One of the doctors I had to go see was my primary for a yearly physical, some blood tests, and I needed a letter from her where she recommended me to have an bariatric surgery, and saying that I would benefit from bariatric surgery. Then I had to see a pulmonologist. With pulmonologist, I had to do a breathing test to see how my lungs were doing, along with a chest X-ray. Um, I also had to do a sleep study where you basically go into the office and you stay there overnight, and they hook you up to a bunch of different wires to monitor your heart beating, breathing, movement, and all the other things. And you try to sleep for at least 6 hours. And that is used to determine if you have sleep apnea or not. In my case, I did have sleep apnea. And in order to get an approval from my pulmonologist, I had to get a CPAP machine, which I had to use for at least 90 days before he gave me his approval. I am still using my CPAP machine today, which I actually have to take it to my surgery for after surgery use, since I am going to be at the hospital for at least 2 days. Um, then I had to go see a cardiologist. And with cardiologist, I had to get an EKG, and I had to get a stress test done. Now, they offered me 2 types of stress tests. One of them is when you get on a treadmill and they check your heart rate, like once you're moving for a few minutes, and another one is a medically induced stress test. Because of my health issues and weight, I they recommended for me to do the medically induced one. This is when you go into a medical office and you are put under a machine that is supposed to take images of your heart, And the way they're able to do that is they have to put a dye intravenously in you. Just will butterfly a needle in your vein, and they put a dye in there, and you go under the machine for a few minutes so they can record your resting heartbeat. Also, I gotta mention that before the test, they don't want you to have anything with caffeine because that could potentially um, interfere with the test. So after they do the resting heart rate, they put some drugs in you that make your heartbeat go high, and you're like there for about 2 minutes, and they see how your heart is working, and then they give you something that is supposed to help your heart to go back to your resting heartbeat, which takes another few minutes. And after all the test results were given to my cardiologist, she was able to give me a recommendation for gastric bypass, um, saying that my heart was healthy enough for the surgery. So I also had to see a psychiatrist. Uh, the reason why they want you to see a psychiatrist, at least my doctor wanted to have me see a psychiatrist, is that since this is a very drastic surgery, they want to make sure that the person getting the surgery is 100% ready and is aware of all the risks they're potentially looking at before, during, and after the surgery. And well, the psychiatrist that I went to, she needed at least an hour long visit. Some psychiatrists might look for longer visit. It really depends on the psychiatrist that you go to. After my visit with her, she was more than happy to give me her recommendation. And while I was seeing all these different doctors, I actually had to go visit a nutritionist multiple times. Now, my doctor required at least 7 consecutive visits with a nutritionist before my nutritionist was able to give me the approval. I mean, her approval. And with the nutritionist, one of the things that they go over with you is pre-surgery diet and post-surgery diet, which are very, very important. Especially with the pre-surgery diet, it gets you ready for the surgery, so you don't have any complications. And the post-surgery diet is very, very, very important for the healing. Um, Basically, the post-surgery diet lasts for whole month after the surgery before you're able to go back to solid foods. Anyway, once all of my approvals and tests were done, my doctor's office was able to submit all the paperwork to my insurance to see if my insurance was willing to pay for the surgery, or at least part of the surgery. Now, as far as insurance goes, the surgery that I'm going for, I mean, bariatric surgeries in general are considered elective surgeries, even though they're basically helping your health in significant way. So it really depends on your insurance if they're willing to pay for the whole thing or the partial thing. So you really have to be in contact with your insurance provider and see what their requirements are. Luckily, my insurance was willing to pay for it. Once my surgeon's office submitted all the paperwork to my insurance. It took them about a week to get back to me. Um, and I got a letter saying that they were willing to pay for my surgery, which is great because it costs a lot. Um, I got my approval sometime in May of this year. I mean, my insurance approval in May. But because of the recent corona outbreaks and lockdowns and restrictions, I wasn't able to get the surgery date until recently. But finally, I have a date, and I'm actually in a process of my starting my pre-surgery diet. So if you're interested in anything else, please leave comments down below, and please just subscribe because I am planning on making more videos about this, especially about my pre-surgery diet and my post-surgery. And thank you for watching, and bye.